Kurt's presented today to have two wisdom teeth removed, and the reason that he's having these wisdom teeth out is basically the fact of the matter that they're very difficult. They're very far back in his mouth. They're extraordinarily difficult to keep clean, and his recommendation by his general dentist to come to an oral surgeon and have them removed was a good one. As far as the removal of wisdom teeth go, what you're seeing today is probably one of the least complicated types of wisdom teeth that we remove. These would just be surgical extractions of two lower wisdom teeth. So, since we're only going to be doing lower teeth on Kurt, open real big. Good job. We're going to anesthetize the lower jaw with a mandibular block, and that has a tendency to numb the whole side of the jaw up, which is a good thing. Okay, open real big and put a little bite block there. Good. So you tell me. I'm just going to touch around. Kurt, rotate your head towards me just a bit. Any pain? Great. With his teeth, I'm hoping just to make a little teeny incision in the gums, just so I can get down to the wisdom tooth, and I can elevate the wisdom tooth, and then deliver it with a forceps, hopefully. Now we always put, Kurt, we're going to put a little piece of gauze in your mouth, just in case this tooth would break, okay, and if it does, you don't swallow it, okay? And this is called a throat pack, and we always use throat packs. That's the way to be safe in oral surgery. Get some pressure. Doing okay? Good. A lot of pushing now, okay? Lots of pressure. Drop your chin just a tad. I put pressure on you here. You can just bite down on the rubber on the other side. Doing great, buddy. What I'm using here is, after I've elevated with an elevator, I'm using a forceps to try to atraumatically take the tooth out. The tooth could break, and if it does break, what we know, or what we do, is just use a small drill to retrieve the small pieces of the roots. And I talked about that with Kurt when he came for his consultation. It appears to me that we did very well with that. Okay, how was it? Okay, not too bad? Awesome. Again, good local anesthesia is the key to oral surgery. I tell that to my students at the University of Maryland. I tell them, if you don't have the patient numb, you can't do the surgery. At least do it comfortably for the patient. Now, what we were just doing there after was curetaging. I spoke about the follicle earlier, and we were curetaging any little bit of follicle that might be around the base of this tooth, and we curetaged that and removed it. Now we go and irrigate out the site. We use a little rat, smoothing down the alveolar process a bit, and the alveolar process is the process of bone which the teeth are in. Good. Some oral surgeons like to use antibiotics in the socket. I'm one of those. Others don't, and I don't know if it's right or wrong, but I think there has been. I've got a very low infection rate, and I've been doing it that way for 25 years, so if it works, keep it up. Now I'm closing this surgical site with what's called a 4-0 chromic gut suture, and a 4-0 chromic gut suture is, in layman's terms, just a dissolvable stitch, and this suture typically is about 4 to 5 days before it dissolves. And we will be seeing him for a checkup visit in about a week or 10 days or 2 weeks, whatever worked for his schedule and also worked for my schedule. So what we're going to do is we're just going to open the gums up just a tad. We're going to get this tooth just a little bit more room to be removed, and there won't be so much pressure on his jaw, and there won't be so much discomfort, hopefully. A lot of pressure. Doing okay? Good. And we'll use our clindamycin once more and put another 2 stitches back here, and we're all finished for today. Doing okay, Kurt?
Mm-hmm.
Good. So upon discharge of the patient, we like to, we always give extra gauze, and we give an instruction sheet. The instruction sheet reiterates what Kurt was told by Tiffany earlier in the appointment, and so he can refer back to that, and he doesn't have to memorize. The instructions. Did a great job, and I look forward to seeing you. On your follow-up.